So this video is going to be about intra-abdominal pressurization, but adding the Kegel or the activation of your pelvic floor. So your pelvic floor is a combination of muscles, your levator ani and your coccygeus muscles, such as your pubococcygeus and your iliococcygeus. Together, those muscles form a bowl in the bottom of your pelvis, and they support your abdominal contents. So very important muscle. Oftentimes, there is a significant amount of dysfunction in them, specifically with postpartum, whether it was a vaginal or a cesarean delivery. So we want to teach how to activate these muscles, how to find them and how to isolate them, but also how to use them in a more functional manner. So these exercises are often prescribed with pelvic floor dysfunction. So pelvic floor dysfunction can come in many ways. It can be urinary or fecal incontinence. It could be pelvic pain, rectal pain. It could be pain with intercourse, a feeling of a bulging sensation. So these are just some examples that could represent a pelvic floor dysfunction. And with postpartum mothers, it is actually a little bit over 1 in 3 women experience at least one of those symptoms in postpartum. So let's go to the floor, and I'm going to show you how to do some pelvic floor activation and then a more functional use or exercise for the pelvic floor. So what we're going to do now is we're going to teach you how to activate your pelvic floor in a couple different ways, okay? So one of the easiest ways to learn how to activate your pelvic floor, how to activate it and relax it, is something we all know, okay? So the easiest way to do it is stop the flow of urine, okay? Or prevent or stop flatulence. By doing that, you are going to engage the muscles in the pelvic floor. And when you do that, you want to think about lifting them up. Think about zipping them up towards your abdomen, okay? So if you have a significant rib flare, just make sure you flatten your lower back, pull those ribs down a lot, but don't brace your abs. You don't want to activate your abs. Your abs should be mostly relaxed with this, okay? So for the cue, we're going to activate the pelvic floor, stop the flow of urine, stop flatulence, and then we're going to lift up, and we're going to hold just for a second, and then relax. So practice the ability to activating and turning it off over and over and over again. So on, off, on, off. We call those flicks, just, or the ability to rapidly contract, okay? This is just for the motor learning aspect and learning how to isolate and contract your pelvic floor. What we also want to do is learn how to contract it in a more functional or useful way, because a pelvic floor, it doesn't just hang out in a shortened and contracted way, right? It would like be doing a biceps isometric contraction and just holding it there, but never lengthening the muscle under load. Your biceps may be strong here, but you would be weak, or you'd be unfamiliar territory as you straighten your arm out with weight because it was never trained there. Similarly, we want to make sure that we train the pelvic floor muscles when it's under load and in a lengthened position. Well, how does it lengthen? Great question, right? When you diaphragmatically breathe, your diaphragm acts like a piston and it descends down on the abdominal contents. When that happens, think about any piston, your volumetric space decreases, but the contents contained within it are the exact same. So it increases pressure. As you increase pressure, it pushes outward on your abdominal canister here, your tube here, but also at the exit point, which is going to be your pelvic floor, that pelvic bowl or that pelvic ring of your pelvic floor muscles. So when we activate the pelvic floor, when we do those, stop the flow of urine and reactivate, it lifts it up a little bit. But as the diaphragm descends down, it's going to start pressing those contents into the pelvic bowl, and it's going to start stretching those. We want to make sure that we strengthen in a lengthened, or what we call an eccentric. The muscle is lengthening under load, right? So how do we do that? You're going to activate the pelvic floor, zip it up, and now I want you to take a diaphragmatic breath through your belly, breathing 360 degrees, 3 seconds through your nose. Hold the pressure, don't hold your breath. Exhale for 6 seconds through pursed lips. Okay, so with that transition from inhalation to exhalation, you're gonna be about 10 seconds. So practice that 5 repetitions. Take a break as needed. You're gonna do 3 sets or 15 total reps for 10-second holds. One more time, we're gonna make sure our ribs are in neutral, our spine is in neutral, our abs are not contracted, significantly. We're gonna engage the pelvic floor. We're gonna zip it up. And now we're gonna breathe 3 seconds diaphragmatically, followed by a 6-second exhale through pursed lips. Hold the pressure, outward expansion, but don't hold your breath. Here we go. Zip. Okay, so practice that. If you have pelvic floor dysfunction, sometimes just performing this, there can be almost immediate results, depending on what your symptoms were and the severity, but just by learning how to breathe correctly through a pelvic floor contraction. Practice these throughout the day. It's easiest to learn these ones lying down. The flicks, you can pretty much do those anywhere, sitting, standing. You can practice them while you're walking. But practicing this pelvic floor contraction with intra-abdominal pressurization, easiest to learn lying down. But a progression would be, okay, let's try them in sitting. Hey, let's try them with walking. If you master those, you can do it on you could walk on a treadmill, you can get on a stair mill, exercise bike, trying to maintain a pelvic floor contraction with intra-abdominal pressurization. If you can do those, and if you can coordinate all those things together, you're on your way to restoration of that pelvic floor dysfunction. So practice these things. If you have any questions or concerns, don't hesitate to reach out. Thanks for watching.